Women's Health and Nutrition. Introduction to the module. Major life transitions like pregnancy, childbirth, and menopause can be physically and emotionally stressful for women. Negative life events, including infertility and perinatal loss, poverty, violence, discrimination, unemployment, and isolation, affect women's mental health and well-being. Due to physical variations between men and women, they require different diets. Women, for instance, are more likely to experience anemia, osteoporosis, and other nutritional deficiencies due to hormonal changes brought on by menstruation, childbirth, and menopause. This module helps to learn about general nutrition requirements for females, the role of female hormones in the body, and the causes and symptoms of female hormone imbalance. Learning objectives. At the end of this module, you'll be able to discuss women's physical health, identify the effect of women's mental health, recognize the female hormones in their work, identify the essential nutrients for women, discuss nutritional guidelines for pregnant women, recognize the necessary diet for UK women. Physical health. Women worldwide have a high burden of non-communicable diseases, NCDs, due to social inequality, poverty, and inequitable access to resources, including healthcare. Although women generally tend to live longer with NCDs than men, they are often in poor health. Even after menopause and during pregnancy, women have an increased risk of non-communicable diseases. Women are more likely to experience hormonal changes, breast cancer, cervical cancer, gestational diabetes, and other conditions. For healthy physical and mental health, regular exercise is essential. It supports improving overall fitness and health, being healthy in terms of weight, lowering the risk for a variety of chronic illnesses, promoting mental health. Benefits of physical activity for women. Regular exercise can enhance women's health and aid in the prevention of numerous diseases and illnesses that are significant global sources of death and disability for women. As a result of insufficient physical activity, many women have the following conditions. Cardiovascular diseases account for 1/3 of deaths worldwide and half of all deaths in women over 50 years old in developing countries. Diabetes affects more than 70 million women, and by 2025, its prevalence is expected to double. Osteoporosis is a disease that causes bones to weaken and become more prone to breaking. It is most common in postmenopausal women. The most typical disease in women is breast cancer. Regular exercise has been shown to lower the risk of breast cancer in women. The advantages of exercise include lowering cholesterol and blood pressure while maintaining a healthy weight, increased social interaction, better sleep, improved mental health, and reduced fracture risk, increased psychological well-being by lowering stress, anxiety, and depressive symptoms. Physical activity has also been linked to increased self-worth and self-assurance, as well as the social integration and equality of women in society. Physical activity for women during pregnancy and the postpartum period. A pregnant woman's general health benefits from exercise. For instance, healthy women who engage in moderate-intensity exercise throughout pregnancy can maintain or improve their cardiorespiratory fitness. Strong scientific data demonstrates that the dangers of moderate-intensity exercise during pregnancy are extremely low and do not raise the risk of low birth weight, premature delivery, or early pregnancy loss. Physical activity may reduce the incidence of pregnancy problems such as preeclampsia, gestational diabetes, prenatal depression, labor length. Regular exercise benefits a woman's general health throughout a typical postpartum time. A woman's mood and cardiorespiratory fitness improve when she engages in moderate-intensity exercise weeks and months after giving birth. The infant's volume, composition, or growth does not appear to be negatively impacted by this exercise. During the postpartum time, exercise also aids women in achieving and maintaining a healthy weight, and when combined with calorie restriction, it helps in weight loss. Mental health. Women are more likely than men to experience poor mental health due to social and economic circumstances. Women typically find it simpler to express their emotions, though, and they tend to have better social networks, which can help people maintain their mental health. Our emotional, psychological, and social well-being are all parts of our mental health. It influences our thoughts, emotions, and behaviors. Additionally, it affects how we respond to stress, interact with others, and make good decisions. From childhood and youth through maturity, mental health is crucial for everyone. What affects women's mental health? 1 in 5 women experiences a common mental health issue like sadness or anxiety. These can arise for various reasons, although several risk factors are common among women. Women are more likely than males too. Being a carer can lead to stress, anxiety, and isolation. Carers UK has information on looking after your mental health. To be poor might cause social isolation and worries about one's safety and work mostly at home. To suffer from physical and sexual abuse, which might affect their mental health in the long run. If you're facing domestic abuse, call refuge. Experience sexual violence, which can cause PTSD, post-traumatic stress disorder. Women often internalize their negative emotions when they find it difficult to express them. Depression, eating disorders, and self-harm can result from this. Women's health issues. Life events and hormonal changes can affect women's mental health. Perinatal depression, a baby is a major life-changing event. It may lead to prenatal depression or postpartum depression in some women, during pregnancy. Both are covered by the term perinatal depression. Perinatal depression does not indicate weakness or poor parenting. Depending on symptoms and patient's needs, assistance options include talking therapy, medication, or specialized services. Menopause. Although every woman's menopausal experience is unique, many women discover that in addition to their periods stopping, they also have other symptoms. Your mental state may fluctuate, resulting in anxiety, depressive feelings, and mood swings. HRT, hormone replacement therapy, or talk therapy are 2 possible treatments. How female hormones work. The human body naturally produces hormones. They impact numerous body processes and help message transmission between cells and organs. Estrogen and progesterone are the 2 main sex hormones in women. Although testosterone is thought to be regarded as a hormone that only affects men, females also generate and require a small amount. Estrogen, the main female hormone, is estrogen. The ovaries create most of it, but minor amounts are also made in the fat cells and adrenal glands. The placenta also produces estrogen during pregnancy. Estrogen significantly impacts sexual and reproductive development, including puberty, menstruation, pregnancy, and menopause. Estrogen also impacts the brain, heart, lungs, hair, musculoskeletal system, urinary tract, and skin. A blood test can be used to determine levels of estrogen. Throughout the menstrual cycle, levels will change significantly. Progesterone. Progesterone is a female sex hormone that the ovaries generate after ovulation. The placenta also secretes some during pregnancy. This hormone's activities play a significant role in the growth and operation of the uterus. Progesterone's major function is to prepare the endometrium, which lines the uterus, for implantation of the fertilized egg. Progesterone levels are kept constant during pregnancy to provide the developing fetus with a healthy uterine environment. Progesterone levels fall if pregnancy is unsuccessful, which causes the endometrium to be lost and eliminated through menstruation. Testosterone. The ovaries and adrenal glands produce small amounts of testosterone. This hormone affects several bodily processes, such as menstrual cycle management, bone and muscular strength, and sexual desire. The testosterone level can be measured with a blood test. The typical range for females is 15 to 70 nanograms per deciliter, and g/dl. Luteinizing hormone, LH. This hormone, although less known, plays a fundamental role in the female reproductive system. It is synthesized in the brain's pituitary gland and stimulates the production of androgens, male hormones like testosterone and estradiol, the most potent form of estrogen. LH plays a key role in ovulation by triggering the release of the egg from the follicle, which is one of its most significant roles. Follicle-stimulating hormone, FSH. FSH is made in the pituitary gland like a luteinizing hormone. It is essential for controlling the growth and reproductive processes. It is one of the hormones necessary for pubertal development since it stimulates the synthesis of estrogen and helps in the maturation of ovarian follicles. When hormones become unbalanced, the hormone levels will change naturally throughout the lifespan. This is usually due to expected changes such as puberty, pregnancy, breastfeeding, perimenopause and menopause, use of hormonal contraception or hormone therapy. But a hormonal imbalance can sometimes be a sign of something more serious, such as polycystic ovarian syndrome, PCOS. Most young females have this endocrine condition. PCOS can disrupt fertility and lead to irregular menstrual cycles. Excess androgen, this is an excess of masculine hormones. This can all result from menstrual abnormalities, infertility, acne, and male pattern baldness. Hirsutism, hair development on the face, chest, belly, and back is increased in hirsutism. Too many male hormones bring it on, occasionally appearing as a PCOS symptom. Hypogonadism. Female hypogonadism refers to the ovaries' inadequate function, which results in the reduced production of sex hormones and germ cells, eggs, estrogen and progesterone. Miscarriage or abnormal pregnancy, a spontaneous pregnancy loss before the 20th week is referred to as a miscarriage. Miscarriages account for 10 to 20% of all known pregnancies. However, the true figure is probably greater because many miscarriages happen extremely early in pregnancy, sometimes before you even realize you're pregnant. Ovarian tumor, the ovaries, the female reproductive organs that generate eggs, can develop abnormal growths called ovarian tumors. Non-cancerous, benign, or cancerous ovarian tumors are both possible. Malignant. A variety of factors influence ovarian tumor development.